Well, good afternoon, everyone, and thank you for joining us for our seventh installment of the Department of Psychiatry's Brown Bag series. We're glad that I can't actually see how many folks are online, and the panelists asked me not to tell them how many folks are online, so I will not repeat the number, but we have folks in our auditorium as well as online, and we're glad to have you all here today. I have a few housekeeping items to go over beforehand. Those of you that have been in this auditorium know it's a very sound sensitive. If you're in the back, sometimes the mics are on in the ceiling, or voices can carry. So we just ask that you keep conversations to a minimum if necessary. Um, we also like to remind you that we do have an attendance sheet in the back of the room or with Amanda standing up with the blue shirt for those of you that are in person. And we ask that you just jot your names down. It helps us keep track and tells us how we're doing here. Those of you that are online, we already have your attendance accounted for. I think those are all of the things that I'm supposed to cover. I would like to say that the OEI, the Office of Equity and Inclusion for across the university, will be sponsoring a Boundless Conference in October. And within the Department of Psychiatry, we are having our book club study for the book called Cast, and it's by Isabel Wilkerson. She will actually be here in October. So our book club leads right up to her arrival. If you're interested in joining, we do still have some spots within the Department of Psychiatry, but OEI has plenty more. And if you are here and you've already signed up and you need your book, Amanda also has those in the back of the room for you. And on that note, I'm so proud and happy to have this group here. Um, they're doing a lot of great things in their area, and I just wanted to have them share the wealth, share the knowledge, share their experiences, and teach us about how and why they are so successful. So this is the Children and Adolescents group over on South Avenue, and I hear some whoop whoops in the audience. um, and we have a panel today, as you can see, well, you can't see yet, but they will be coming up to sit at the table at some point. But I'm going to bring up Dr. Linda Alpert-Gillis to start us on our journey for the afternoon. All right, let's give her a round of applause, everyone. Thank you.
Thank you. Thank you. It's a pleasure to be here. And I'm really proud to be here with my wonderful team who represent all of our outpatient services in all of our locations. So we're really happy to be here to tell you a little bit about our journey for inclusivity. So I'm going to just talk very briefly at the beginning, and then we're going to talk about building inclusive and psychological safe spaces, the initiation and implementation of the racial justice team under Shunthill's leadership, and our community outreach and parent involvement. All right, so nothing happens in a day. And especially at the University of Rochester Medical Center, you really have to kind of have the long view. And so I thought it would be interesting just to very briefly kind of talk about kind of our timeline of initiatives that we've taken, at least going back to 2007. I thought it'd be really bad to go back to 1987 when I started. So I thought we'd start at 27 when we had the GPE training program that really emphasized not only serving marginalized communities, but also recruiting people to train from marginalized communities. And so it became an avenue to be able to move our agenda forward. In 2013, we reintroduced the Family Advisory Board to get voices from our parent partners. And that was an important step. The Family Advisory Board is part of the DPAC, the larger system in the medical center for patient representation. We got a grant in 2019, a small grant from the Greater Rochester Health Foundation, which was focusing on empowering parent voice. And we'll have a parent here speaking today who was part of our original initiatives and has continued on with us through all our different iterations of that. And then some things happened. The death of Daniel Prude made a big impact on the clinicians and families of that we serve. And so that definitely made us feel like we wanted to do more. The DICE board was created, which I am a member, and have been was really energized by that. Then we had the death of George Floyd, which made everybody feel like they need to do more and more and more now, which was great. And so we decided that in the child division, we would create the Racial Justice Initiatives Group as complementary to the work of the DICE board to make it more at the ground level, if you will, as a kind of a grassroots undertaking. And so Sean Hill, who was then a senior mental health therapist and became later clinical coordinator, embraced that and decided to take that on, which was wonderful. And then we felt like we needed to do more and more and more outreach. So Jerard Johnson, who has had been with us, really, we felt that all his community work was so important. We wanted to kind of label it, give him space to do it, and really give him the resources to do it right. So in March 2021, he became the community liaison for the child ambulatory and in some senses acute services as well. Jerard also became the associate coordinator of the racial justice initiatives, working alongside Shun because it just dovetailed so nicely. And then in March 24, just recently, Delta Koudaya-Smith, who was in the Keith, I don't know why I said Smith, Keith, who was in the process of finishing her master's in public health, which she did in May, wanted to join the team, and we welcomed her with open arms to include her voice as well. So it takes a while to get things going, and it has to be a concerted effort. So kind of our mission is to create an environment where everyone feels valued, respected, and safe to be their authentic selves without fear of discrimination, judgment, or harm. We're designed our group to promote and support the well-being and participation of all staff and families that we serve, especially those from marginalized or underrepresented groups. And so we've been focusing on increasing awareness and addressing disparities in our service, engaging and partnering with BIPOC communities through outreach, not expecting people to come to us, but reaching out to them, fostering inclusion within our services and the community. And you're going to see great examples of all of these, and empowering and incorporating youth and caregiver voice in all programmatic decision-making. And so the last thing towards that end is we now have a family member co-lead all our family advisory board meetings. All right, so without further ado, I'm going to turn it over to Delta Koudaya-Keith, who is a mental health therapist at our East River Road location. And in addition to being a licensed mental health counselor, also has her master's in public health.
Thank you. So in talking about some learning objectives today, we really want to focus on how do we really understand the importance of inclusivity, and how do we highlight some of these concepts. In thinking about this, we realized that we have to go beyond just knowing about other cultures. We have to really involve our services to adapt the unique needs of each patient. This means that in treatment teams, we're really highlighting and supporting clinicians on casework and supervision, really making sure that our care is patient-centered and culturally sensitive. whether this means involving interpreter services to make sure that family feels heard, and family really feels that the care that they're getting is competent to their specific need. Additionally, we really have been really focusing our efforts on reducing bias. This means our interactions with each other are very critical. How do we reduce bias if we're not intentional with each other, if we're not intentional to respect each other's pronouns, the way we speak to each other? When we cause harm, whether it's among staff, patients, families, being able to recognize that and offer support, and how do we heal and move together as a team, and really building that trust and fostering an inclusive environment. This means that we are engaging in implicit bias trainings, as well as rigorous self-reflection. We've identified as a team for our clinic that these are going to be the key tools in which we continue to improve to really highlight the importance of inclusivity. Additionally, identifying barriers and recognizing barriers has been an important piece of our work. Recognizing that systemic barriers exist, acknowledging that they exist, actively identifying them and how they impact services, right? If families aren't showing up consistently for us, how do we reach out to case management to offer family support without the family having to be the one that is doing that one more step of a barrier, right? If a mom has to take a bus to bring kiddo to services, how do we then get medical motors involved? And those little nuances, and ensuring that we're working as a team to reduce as many barriers as possible so that families feel supported. Additionally, barriers, language access, socioeconomic challenges, and multicultural misunderstandings. We're recognizing and acknowledging as a team that we may sometimes cause harm. And when harm is caused, how do we then bring the family back so that we don't lose that family to our service? How do we engage and make sure that we're reducing that barrier as much as possible? It is important as for a team and our service, and we've recognized that the lack of inclusivity can result in lower engagement with services, can further drive mistrust between the families and kiddos we're serving, and ultimately leading to worse mental health outcomes. And we want to reduce that as much as possible. So this leads us to exploring strategies to really solve this, building trust, making sure that we're doing regular community outreach, making sure that our conversations are tailored. So when we get a new family, ensuring that the packet that they're getting at home with their families is really tailored communication, partnering up with local leadership groups to make sure that our services are approachable, whether that's school, churches. Jerard will speak more to this coming up. Using really inclusive language, making use specifically of pronouns or other gender or identity affirming language has been a real goal of our service, and an important thing that leadership has highlighted to us, as well as our group supporting that for our clinicians. Really promoting inclusivity in our physical spaces, ensuring that we're displaying culturally diverse imagery everywhere in our clinics. At our location in the front, typically the screens display families that look like all families that are receiving services, that the language is understandable, and that everyone feels welcome. We also really want to recognize the importance of why we need diversity. So it's one thing to identify strategies to solve some of our barriers, but really understanding why diversity needs to be tailored to our services and addressing them. This includes hiring more multilingual staff, and our leadership has been intentional to make sure that new staff recruitment is really targeted to serve this culturally relevant care model that we're after, and really providing services that are tailored to low-income families. Okay. So some benefits of having an inclusive and psychologically safe space. Improve productivity and creativity. As clinicians, productivity and creativity is a part of our language, right? When you think of social sciences, they're typically the people who were funky and fun in school. Those are the people who go into these fields, and we want to really make sure that we're supporting that. We want people to understand that they feel comfortable expressing themselves. So the racial justice group has been a space where for you to come and get support without fear of judgment, and that your creativity can really flourish. Really driving a diverse perspective innovation also. Increased morale and engagement is another point that I wanted to highlight really quick. And here we wanted to say that when individuals feel respected for their unique identities and contributions, their motivation and satisfaction at work has a ripple effect. And we've seen that the literature has shown that. And that ripple effect goes as far as how we serve our families, how happy we are when we leave work. So it's a all-around system that really impacts the way we show up at work and how families benefit from that. When we look at how having an inclusive space helps with better mental health outcome, really wanting to highlight that preventing burnout, which has been a huge target for our leadership this year, really preventing burnout, really making sure that clinicians are feeling supported, families are feeling supported when they show up, and really driving that connection between inclusivity and making sure that we're not feeling marginalized or we're not feeling supported. And ultimately increase engagement for the family. When the clinician is able to show up and be their best self, family is going to benefit from that. And those are the people we're providing service for. And if family feels satisfied and is engaged, we see better outcome for students in schools, right? Mom is going to report less stress. And we know a term that I've been using recently is life is lifing. And life has been lifing for all of us, right? And why not feel supported and build trust with families if I show up? I'm being mindful of time. If I show up and I'm able to support the families that I'm working with. Okay, so some key element. Really, leadership has been making sure that we're doing a lot of employee surveys and feedback, and really taking that feedback and implementing it, and making sure that we're answering some of those things that staff is saying that they need in order to drive home an inclusive space. Using inclusive language, again, making sure all of our hiring practices are very diverse. I wanted to highlight really quick here that leadership commitment, right? We always get weekly emails from Linda about a training she's really encouraging us to go to. And that leadership commitment really shows up also in our leaders saying, we want you to take the time and do this. And so we will give you some reward in the back end, whether that is reduced units for our staff, whether that is time that you are giving so that staff doesn't feel like this is one more thing I have to do, and it's really complementary. One thing that she's been highlighting for us is the Boundless Together conference, for as much of our staff to join and show up for that and participate in that. And I think that's it. Oh, and promoting self-care. Part of our treatment team has been every 3 months, one of us is responsible, a staff member is responsible for a self-care, I'm going to go back one more, a self-care activity. And making sure and intentional and giving space during treatment team meetings so that that is actually happening. And this effort is so that clinicians really feel supported, and it's not just we're telling you what to do, but we're also really giving you the space and creating time for you for those things to be actionable in order for us to see the change. Finally, we've really been pushing for training and education on diversity and inclusion. Our Lunch and Learns, the third Tuesday of every month, have been dedicated to having speakers who are experts in those fields come and give us lectures of things that we could learn, right? In services, interpreter services, these are all ways that we're being very intentional as a team to make sure that our service and how we're showing up as a clinic is really impactful. There has been clear policies against discrimination, and it's important to note that it is discrimination not only for staff, but also for families and vice versa. Cultural competency, being aware of our unconscious biases. And ultimately, our goal is to understand the healthcare needs for diverse populations. These include LGBTQI individuals, racialized and ethnic minoritized groups, and all people who have disabilities. I'm going to pass it to Sean.
So I get to come to you and talk to you about all the different things that the racial justice group has initiated. So here are our racial justice initiatives. We're going to go back as far like when Linda talked about Daniel Prude and George Floyd. We had an art show where as adults we can express our feelings and emotions to one another, but our kiddos, they went and they participated in this art show to express their feelings. And we had a lot of creative art therapists that helped us with initiating this role. I want to say there was between 50 to 100 submissions, and we had to be creative because it was during the COVID period. So we did it online, and we did a Facebook Live where the therapist actually commentated on each and every artwork and gave the kids the option to see their work during that period. And then eventually the artwork transitioned over to the Bridge Gallery Center, where it was on display there for several months. We do things like, we love to eat. So that is a given with us. So you'll see a lot of our initiatives that are related to food. And so one of our clinicians, they love to bake, and they started off wanting to bake cookies for around the holidays. And then we transitioned into making it a cultural cookie bake sale where we included all types of different things. And we specifically made sure that each item had an origin where it came from. So the Mexican cookies or the pound cake from Europe and things like that. So we're making sure that we identify these different areas of things. If you're in psychiatry or around, you've seen some of our fundraisers where we did the Equity for All jacket sale. We're intentional with this. We want to make sure that people know that we value equity, we value inclusion, we value diversity. So why not just put it on your sleeve so everyone else can see that you're where you stand with those things. One of the things, again, food. One of the things we love to do is I've had a thought of around mental health, Minority Mental Health Awareness Month, is that we will gather together, clinicians of color, staff of color will gather together, and we will have lunch together where we're discussing things that they see that is very important to bring to the clinic, some things that are working and some things that are not working. And we give them that safe space to be able to do that at our luncheons that we have. We've done this for a couple of years now. We've got a lot of feedback and how people are feeling appreciated and during these lunch schedules. And then we have our racial justice lunch and learn, like Delta hinted on. These opportunities, the third Tuesdays of the month. We have brought in many different professionals for Autism Awareness Month, we brought in Dr. Lorna Washington, and she was a she's a person of color whose daughter, you know, has a diagnosis of autism. And she came in and she spoke to us about how, with even being educated, that she was challenged with finding the resources for her daughter, and how that looks so much different from her counterparts who have the same diagnosis, but were given just a worldwide of resources that she was able to receive for them. So she spoke to us and she gave us some tips on being providers of how we could be very supportive for families who don't look like our counterparts, to be able to provide them with the resources and the education, because she didn't also have, although she was educated, she didn't have the resources. This is her first child. We've also just recently brought in an interpreter for Somalia, and was giving us different advice on how people from different countries or ethnic backgrounds, our strategies as Americans don't work for every background. And so she was able to give us some things like how, you know, in different countries, we don't come home when the street light comes on, right? Like, you're home at different times and things are very different. So when it comes to sleep, we may have to listen to the family and hear what their cultural background is when it comes to different strategies that we suggest and how that will or will not work for them. The racial justice is everybody's invited to come. We open it up for both clinics. And like I said, it's always good to have someone to come in and give us some support on ways that we could be more inclusive with our families. Long time ago, we had the Theater of the Press, which I think is now called Theater of Health and Equity. And Chanel Anderson came in with us, and we were able to get them to do some role plays where we're having these uncomfortable conversations between staff and with families. So that was a very good experience that I think everyone benefited from. And it was nice to have someone else come in and share in that experience. We do a lot of, I call them friendly competitions between our clinics. And what we would do is we will see who can collect the most of something. And in this particular place, we collected hygiene products. Right now we're doing one for school supplies. And these supplies go to helping out within our community. We want to make sure that we are serving the people that we serve. We're putting our money back into the communities that we actually live in and we work in, and the people that we serve. So the hygiene product collection was a good one. And we donated all our supplies to the Mary's Place Refugee Outreach. Very appreciative of that. And then we've also done like this, the school supply will go to maybe an underserved classroom, or maybe we'll go to some of our clients who don't have the funds to actually, school supplies are expensive nowadays, that cannot afford these school supplies. So we'll make sure that we are intentional about making sure that people who are underserved are benefiting from our initiatives. We've tried to have a book club where we would read things with about racial equity and diversity, and we'll pull articles and books, and we try to kind of make sure that's included in some of our racial justice meetings where we would discuss some of these things. And again, we make it intentional by supporting Black-owned or Brown-owned businesses within our community. As you might know, Hispanic Heritage Month starts on September 15th and goes to October 15th. So we will collectively, as the clinics, will put an order together between all of us, and we'll search for a Hispanic-owned restaurant, and we will support in that way, so that we'll make sure that we're, again, giving back to our community, serving our community, and recognizing and honoring Hispanic Heritage Month in some kind of way. Sometimes we put out an email just to give the history of Hispanic Heritage Month. So sometimes that will float around. But every month, the Racial Justice Group tries their best to make sure we're bringing some type of awareness for that month. As I spoke, Autism Awareness Month, we will do something, which you'll see later. We'll do our funky sock wear, where we're saying that everybody's unique, they're different. So we'll show our kids that we are aligning along with them. And then we make sure that we're purchasing things from Black-owned businesses. We reached out to a company who did our Juneteenth T-shirts, and we've had someone create our autism awareness T-shirts as well, as we can wear collectively as a group at the within the clinic. And I already spoke about Hispanic Heritage Month. So something else we do, we like to decorate our doors. We would decorate for the holidays, but we mainly have a competition for Black History Month, where we would see which clinic can decorate the most doors. I'm gonna brag on mine. The last one right there is like, I am Black History 365. So I put a little work into that one to make sure it's on display, but it's something that I enjoy doing. So the Racial Justice Group is very supportive of making sure we let our kids see what we do for Black History Month. Here are some more photos that we have done. Pride was just most recently. We walked in the Pride Parade. We actually have a team, the gender and sexuality team, who actually led this group and put us a team together so we can walk in the parade. We did have one client or patient that walked with us, which was unknown, but it was fun to have them there. In solidarity, we wear orange in awareness of gun violence. So we'll put an email out there, make it awareness for what goes on with gun violence, since we know Rochester has a huge gun violence problem. There's our funky socks, where we all got together, wore our funky socks. Again, it was back in COVID time, so we're all masking up. And then we also are promoting, awareness of domestic violence and interpersonal violence. So we do this as a team. We make it intentional that we are supporting these initiatives, and we have fun doing it. So I think that's why we get such a big turnout for the things that we do. And with that, I'm going to turn it over to Jerard Johnson.
All right. Well, thank you, Shun. Wow, it's amazing working for a clinic that embodies what I call the system of care principles and values, where I believe that there are family-driven, youth-guided, culturally competent, trauma-informed, and community-based. It's great to work at a clinic that embodies these principles and values. And we look at community engagement with parent involvement. I believe that no matter what type of work that you do, it's so important. We are experts in what we do, but the family's experts in their children's lives. They're with their children 24/7. So they're the expert. We're like, I like to say, the guide on the side. We're helping them guide the bus. And one thing about our community engagement, we're just going to give you a few strategies, but we like to take, the model have been the clinic outside of the clinic. And we've been engaging in our community and not just staying behind the four walls and letting them come to us, as our director said earlier, but us going to meeting our families where they're at. And we know it's no secret, we have wait lists for our families to get in to see therapy. But one of the things I like, we was able to, and you're going to hear the strategy, we was able to do our homework. We was able to do our homework and to get the feedback from our community on how we could better assist our community. How can we engage our community? And one of the things that we heard back from our community was just some education and resources. How can we just get some information? Because we're thinking and feeling that all you want to do is give our kids medication, takes our kid away from us. We don't want to take them to see the therapist, or we're not going to let them really talk too much or share too much, because they're going to take our kids away. And we're like, no. That's not what we're about. That's not what we're doing. So having directors that was able to say, you know what, let's take this outside of the clinic. Let's bring education and resources to our community. And that led to our community conversations. Our community conversations came about where we're educating our community on signs and symptoms, when to seek behavioral health care, the duration. Medication management was big in the Black and brown community, because that's how they felt like you're just going to over medicate our children. So we were coming with our full team, and we were saying, no, we're going to educate you on medication management. We just don't want to give medications. We use strategies. We use different things before it leads to medication. And we're going to talk to you about the benefits of medication and let you and your family make that decision. So we found that was very helpful. And that community conversation led us to churches, temples, mosques, even fire districts, Rochester fire departments, was calling about connecting connecting to know about community conversations because they wanted to be educated. They wanted to receive some type of information around children's mental health and behavioral health. So that led to those community conversations. And then we also said, wait a minute, let's connect to our community some more. So we also got into some schools with, community resource tables. We partnered with schools, parent family advisory teams, youth and parent family night. We was able to connect with them and engage with our community on health fairs, resource tables, bringing information to our community with our brochures, just letting you know about the clinic, what we do. Having little swag bags for our community. That's also building trust in our community as well, right? Letting the community know that we're not just big entity coming and telling you what you need to do, but we're listening to our community and saying we're going to work together and work collaboratively on how to help meet the needs of your family and our community. So that was very big for us, being out in the community, having resource tables, health fairs, connecting with our school partners, our family advisory teams within the community. So there were some strategies that we also utilized. Like I said earlier, we did our homework. We developed an understanding of the community history of some of the challenges in our community, the mistrust in our community. So we did it by surveys, active listening, research, talking with our families and saying, listening to our community and saying that, okay, things has been going this way for so long, but we're now looking for change. We're looking to have a better partnership and collaboration with our community. And that's where partnership and collaboration came in. We worked together, came to common goals, leveraging that diverse skills and making sure that, we were fostering teamwork and innovation. Some of the things that we've been doing, some of the things you saw in our presentations from Shun and Delta is just amazing at some of the things that we've done in our community connections and community partnership, even within our clinic, just creating that partnership and collaboration. So we just don't do it outside of the clinic, we do it inside of the clinic as well. So we make sure that we role model those things inside. You heard it talked about a lot about create equity and inclusivity, making sure that in community engagement, that we're ethical and we're effective at PBH&W, establish an environment that allows patients, staff, and community partners to make meaningful contributions and to have a voice, right? We want to make sure that our staff, our patients, and our community have a voice and that we are listening and going to make some changes or whatever we need to do to make this thing work. And a commitment to transparency. We believe that was a key functioning, a trusted partnership at our clinic, that we should be transparent about things that we can offer and things that we cannot offer. So we made sure we put that out on the table that, we do have, there's some things that we could do, some things that we cannot do. But if you want education and resources, we're there, we're partnering, we're collaborating, we're listening, we're being a seat at the table and authentic. And I love it because we give an authentic voice to our patients and to our staff. And then also the last one I'll just give, there's so many different community strategies we've used, but build and maintain trust. That's when you and your partner trust each other. Partnership can be easy, but however, building trust takes time and effort. Like Dr. Gillis said earlier, it just didn't happen overnight. It took time and effort. Our chief, Dr. Mike Sharf, is here, and it took, being out in the community, right? It took time to get us to get to where we're at, but we stood steadfastness and making sure that we were in it. And as a community partner, it's trusted. It's make sure that your organizational staff and community trust you and that you're seen. We can say a lot of things, but unless you're seen and being out there, there's a quote that I live by. People don't care how much you know till they know how much you care. And when your community sees that you really care, you're not just sitting within the four walls and you're getting out there, doing community engagement, it's very key. So that was just a few strategies around some community engagement, but having buy-in from leadership, doing your research, doing your homework, connecting with your community, thinking outside the box, being very intentional. We built relationships. I often say what you do before a crisis helps you in a crisis. So it really just helps you to be able to connect with folks. And then this is some of our community engagement. We are at, Rod, that was at the Blue Cross Arena, yeah, Blue Cross Arena. What an Amex game. We were partnering with some a Healthy Baby Network. We just love, just being out in the community, education, educating our folks. Our Strong Stroll. We were participating in our Strong Stroll. We're just at most community events, and that's just showing our community that we're there. We out here. We're listening. We're engaging. And I would say also say this: having a buy-in from your department heads and department leaders. This is our community conversations. We're at our church. We've been to churches, temples, and mosques, educating, just bringing resources of education. We did a presentation at quite a few churches. Sorry, that's the only picture I could find. That was way back. And then also I would say just, have a conversation with elected officials because they're advocating. This is when we just took a tour with Senator Samara Brooke and Dr. Sharf and Dr. Kenya Malcolm. We toured our facility at South Avenue because she chairs the mental health in the Senate. So just making sure that you're connecting with allies who can advocate, who can help fight for our families and children. I don't do the political debacle stuff, but I want to make sure that our children and families get what they need, and having allies and advocates that could fight for the system, is very strategic. So with that being said, also having a partnership, having our parent involvement is so key to us. And like I said earlier, having working at a clinic that believes in parenting and parent engagement, that's going to lead to one of the best family parent voice person that's here today. Jason is going to come and share his experience about being a parent and being engaged. So let's receive Jason.
Good afternoon. It's a great opportunity to be here today. And as I was sitting there listening to our team, one of the words they constantly said was community. Well, I am the community. I come today representing the community as a family and just part of the community that they represent and that they serve. I've been working with this group for several years, and I've seen so many changes come about. I must say Dr. Linda Alpert-Gillis is such a strong advocate for seeing diversity, seeing brown families that get served, also seeing brown employees that are there, but also not just brown families, but all families, to see someone that looks just like you so you're comfortable with that. We've done a lot of community events, going to churches, as Jerard was just saying, churches. We've gone to schools, and every opportunity that they have, they invite a parent. I think it's so important to have a parent at every meeting that you can have them at, any decision making you're having, because you're making choices for my child. You're making choices for our children. And how can you make a best choice for my child or for our children without knowing what my child or our children need? A lot of the things that have gone implemented, we've had a part of that, such as our letters that go out to the family as, hey, we can't get you in right now, but here's some opportunities. The Strong Stroll, we get asked questions about that. They just opened the Brighter Day Urgent Care. We had input on that. It's so important to have your families not just seen, but heard and with intent. And that's what happens with this group. I must say, it's such a proud work of mine that I do with this team because I see results. I'm a proud parent of a child who's received services, who's blown my mind because of the services that he's received here. I constantly am asked questions about it because after we do these community events, these are familiar faces that they know us from church. They know us from these schools. Then they come back and say, hey, you know what? I got a question for you. When you went there, did they this? And we have answers for that. I mean, yes, they come as the experts, but however, I come as an expert for my child. I come as an expert for my community, and my community relies on me. It asks me questions because they're my community. I'm part of this community. I'm not going to do anything to hurt my community. And once we continue to show them that this group is growing, this group has the best intent for us, we get more buy-in. And it's such important to try to break the stigma in our communities for behavioral health. And with this group that we work with, we've been able to do that. I don't have much to say. I just wanted to share that information, see if I have another slide there. But continue to have parent voice whenever you can. Continue to allow parents to sit at a table, not just to be seen, but listen to what they have to say because we have so much to give. And that's all I have.
Thank you. Thank you. We're going to have the panel going up to the table and get ready to answer any questions online or from the audience. If you raise your hand in the audience, we have microphones that will be brought over to you. But I do have one that looks like something has come through. Actually, no, not yet. I'm going to actually stand over here. So I will say this is a group that I have been kind of affiliated with since 2020. And that's before I came to the Department of Psychiatry. I was asked to participate and help lead a training with, as Shun had mentioned, the Theater for Healthcare Equity. At the time, I think it was Theater of the Oppressed. And I was thoroughly impressed to the point to where I felt like I was a part of this group, even though I wasn't even a part of the department at that time. And they actually walk the talk. You know, it's not, some people just talk and talk and talk. They actually walk out their talk. They believe in being authentic. They believe in building those relationships. Everything that you heard here today is who they are. So I just want to say that and thank you. I've been trying to coerce them to coming here and speaking, and I'm glad that you all here and online were able to hear who they are. Any questions? And give Kennedy a chance to run the microphone over while I look at the question that's come in here. Okay, I'll go ahead and start with this one. What are some thoughts from the group on integrating a community-centered approach on quality improvement efforts? I can read it again. What are some, what are some thoughts from the group on integrating a community-centered approach on quality improvement efforts?
I think for us that has really meant our parent partners. Okay. Hi. I think for us, it's really meant really relying on our parent partners to bring that voice of the community to our quality improvement efforts. And so both through the Family Advisory Board that we have, as well as our parent advisory group through the Greater Rochester Health Foundation and the National Parent Leadership Institute, to hear that feedback from them and to design quality improvement initiatives from that source.
Anyone else want to contribute? And it's okay if not.
No, I mean, I agree with Dr. Linda was saying. And also, anytime with community is involved in that for improvement, is involving, getting those community leaders and getting those folks who are very prominent in the community, getting them together, also just to get their thoughts and opinions, and then bringing them together to say, okay, how can we collaborate or work together on making improvements in our community. So you got to have community members and community buy-in along with the system buy-in to help make the change that our community needs. I'll just add.
Thank you. We'll see, we have a comment from Dr. Telva Oliveras. Just a comment. This is a terrific work, everyone. Congratulations. I love how you all checked off on all of the ERAP goals. Thank you. Another question that's come through. Let's see. Do you have any recommendations on how we might be able to support this initiative from an ED perspective with our pediatric families?
Anybody else want to take that question? So it depends on what you mean by ED in terms of if you mean the pediatric emergency department or the psychiatric emergency department. But I would say that working together with Dr. Mike Scharf in creating the new Brighter Days Urgent Care Center has been our main response, is that we're trying to create in that urgent care a welcoming, family-friendly space for youth who don't, and Segundo, Robert Ibarra as well, who's here today, who's the medical director of the urgent care, to really create a welcoming space for kids who don't need that higher level of care that's available in the psychiatric emergency program. And so really trying to offer an alternative to people in the community that are facing an acute crisis to really be in a family-centered space to be able to meet their needs. And so, that's probably one of the things that I'm proud of, even though like listening to all this makes me feel very proud. That's another thing I can feel very proud about is our development of the urgent care. And so I feel like that has been key. We know things are not great in the ED. And so we continue to also partner with our wonderful providers in the ED to try to bring family feedback back to them. So we've had whole family advisory board meetings dedicated to the inpatient unit, dedicated to the emergency department. We've had people from the emergency department come to our family advisory board and hear direct feedback from families' experiences. And then we've seen them make changes based on that family feedback. So I think if you empower family and youth voice, you hear the answers that you're looking for in terms of how to better serve people.
Thank you. I think we have a question over on that side of the room.
Hi, can you guys hear me? So I thought it was so great to hear all the community building things you're doing. I guess I have like just sort of a practical question in terms of implementing. Like, does someone take the lead on that in terms of, I don't know, coordinating the like crazy sock day or wearing the same color or whatever? Like, how have you gone about like
I'll let Shunthenia.
implementing those things?
So like we said earlier, we have a group every first and third Tuesdays of the month at 12. The group gets together and we talk about what our initiative for the month is going to be. So we'll ask for volunteers and we'll ask for buy-in to spearhead the initiatives, and whoever wants to take it will take it from there. The most initiative is a collective decision, and we just kind of all hash out all the ideas together, and then we just implement after that.
Oh, I mean, maybe you could say about 20 people.
How do you let everyone know? Maybe you just like email the whole clinic?
Yeah, yes, it's emailed out. Yeah. Our groups are usually anywhere between 10 to 15, 10 to 20 people at a time. So a lot of people already know in the group what we're going to do, and then we will email to the entire clinics about what the initiative is for the month.
Yeah, and it's pretty cool because we all celebrate cultural celebrations, cultural awarenesses. So, I've learned from a lot of my colleagues on their culture and their awareness and celebrations. And then we're able to send out history. We're able to send out a blurb via email. And then, as Sean was saying, we're able to get creative with different ideas. And that ED question, you could take that back to your ED. Take these things back to create. You have to take ownership of shifting. I don't want to say, I'll get into this thing about mental models, but you can shift the different mental models and assumptions and beliefs that people have, shift that of the ED and start creating an environment that's inclusive, that, bringing fun things to that environment to help change that environment.
So I was, my question is, how do we, with the jealousy that we may have from the inpatient service to outpatient services, that we don't have those, what do you think are the suggestions that we can take from you to have these services in our
Well,
inpatient?
I'm so glad you're asking, because in your role as the chief of acute services for the child division, you could do a lot. And so like one of the things that I've been thinking about is that, having more regular meetings so we can like share all these ideas so they can also be shared to the acute services as well.
We have a couple more questions that have come in. Is there anyone in the audience here that'd like to ask before I move on? Okay, just raise your hand and Kennedy, who's over there, will bring you the mic. How do you go about assessing the impact of all of these activities?
Well, we have different ways of assessing the impact. So I think the first is that we yearly give out a standardized patient satisfaction questionnaire, asking questions about how people perceive our services. So we use a client satisfaction questionnaire, which is a kind of the gold standard in evaluating satisfaction with mental health services. And we do that every year. And probably what's most important are the comments section. because we learn a lot about the impact from the comment section. So we get comments like, oh, I came to you because I saw the team at breakfast with the principal and I felt comfortable coming. I thought, you know, it really clarified for me what it was all about and that you weren't going to force my kid to take medication. Or we met you at the church, or we met you at the health fair. So we're going to be, I mean, Jerard, I don't know how he does it, but like last weekend, he was at the Red Wings game on Sunday. And where were you Saturday?
Oh, Boys and Girls Club.
The Boys and Girls Club. So it's a lot of outreach. So we hear the feedback directly from the patients that we serve about that and from the families that join the Family Advisory Board. We have a very flexible model with the Family Advisory Board, which is a little bit different from the larger DPAC system, is that we say to families, we know you're so busy. We're not going to ask for like a multi-year commitment or a monthly commitment. Come when you can. And when you can come, we want to hear what you have to say. And so hearing the feedback, both from the standardized questionnaires that we use, both from the comment section, our rate of, and our client satisfaction questionnaire is that we're always like above the 95th percentile in most of the areas that taps. And so that's why we usually look to the comments to make positive changes in terms of quality improvement activities. But also just hearing from the community. So lately, like this morning, I did a talk for the Office of Mental Health Monroe County providers about the urgent care, and just hearing the questions people have and hearing the feedback people share about our services lets me know that we're on the right track. Or another thing to look at is the longevity of the staff. So historically, we've had very, very little turnover. We did have more coming out of COVID, like many people experienced. But every month for the outpatient services meeting, we announce our work anniversaries in terms of how long people have been with us. And it's such amazing to see the longevity of our staff. And so even though we're growing and we have a lot of new staff, it's also wonderful to recognize how long staff have been with us.
All right, as we conclude, I have some comments here. One, we need to clone Jerard.
Yes.
This was a wonderful presentation. Strong recovery has finally been challenged. That's another. There is a question from earlier. Can you speak, and I know maybe you can do it briefly, part of it or all of it. Can you speak to the process of how you've gotten here? What were some of your stumbling blocks?
I'll let Linda go. We didn't get, like I said, we didn't get there overnight. It was some challenges because anytime you're dealing with different people, you're dealing with a lot of different things that come up. So you're dealing with their own mental models, assumptions, and beliefs. So education, training, hit and miss with the community and connecting with different folks in the community. Those are some of the stumbling blocks, I think. But staying persistent with it, I would say, and you guys.
Yeah, the only thing I would, the only thing I would add is it's always a balance between productivity and seeing enough patients to stay in business, and yet also devoting enough time to these efforts. So it's a real balance. And so you have to kind of have your eye on all the balls at once, because also, like, if you take staff out of the clinic to do other things, you're also reducing clinical capacity. So it's really a balance. And I feel like, it's a little bit, sometimes we tip more one way than the other, but I feel like it's a necessary and important endeavor.
Well, on that note, since it brings us to the top of the hour, I want to thank you all for being here. Please, let's give them a round of applause. And you're getting applause online as well. And thank you. And if folks have questions, feel free to reach out. Their contact information should be included in the invite.